So in this second screencast, we're going to think a little bit more about who is vulnerable to food insecurity. And vulnerability is a term that's used for individuals and populations where they're unable to anticipate, cope with, resist, or recover from the impact of disaster. So that's kind of seen as an overarching definition, really, in the context of health and then health in relation to the environment that people live in. So that's a more kind of global look at what that means. But if we think about our vulnerable populations in the UK, who are the vulnerable people generally? So this is, that initial definition isn't just about nutritional vulnerability. It's about vulnerability in its broadest sense. But who's vulnerable in our UK populations? So there are people who, for various reasons, are not well integrated into our healthcare systems, and they become more vulnerable. And that might be people from different ethnic minority groups or from different global heritage. It might be people for whom the culture of the UK is not conducive to them feeling comfortable accessing things or understanding the way that health works, because health works in very different ways in different countries. It could be economic barriers. You might have a hospital appointment, but actually not be able to afford to get there, not be well enough to take a bus, not being able to afford taxis. There are all sorts of things that affect that. And that's affected by geography as well. And certain health characteristics make it more difficult for people to access different services. And that may include health services, but it also includes food services of various different kinds. So thinking about your determinants of health, you've got people thinking who are vulnerable because of their social deprivation. And this little diagram here just kind of puts it into perspective of public policy as well. So we've got people who might be, like most of us, not poor, not vulnerable. We've got people who are vulnerable for various reasons, but people who are vulnerable by income. And if you're vulnerable by both income and social deprivation, then you're going to end up being in a more difficult situation. So those who are in the worst level of vulnerability are the extreme poor from an income perspective. So it's just kind of trying to put it into perspective. We're thinking about income, we're thinking about deprivation factors, and all these practical things that make people more vulnerable, as well as just income. So it's more than income that we need to be thinking about. And the reason public policy is kind of going through this diagram is because the idea of public policy is to try and help people move from being in this red area of extreme poor to less poor, less vulnerable. So if you have good public policies, that's what they're trying to do. They're trying to support people to become less poor and less vulnerable. So we're thinking about nutritional vulnerability. If you think about it, there are a broad range of conditions, which we're learning more about at the moment, that make people more likely to suffer from nutritional vulnerability. So anything that increases requirements, decreases absorption capacity and ability to process nutrients, all of those kinds of things. So we're thinking about cancers and severe infections. COVID, for example, caused a lot of people to have increased nutritional requirements, but also decreased ability to consume sufficient requirements. So there's lots of different things, lots of different conditions that affect our ability to take food in and utilize it. So we've got this undernutrition of, macronutrients, energy, protein, and or specific nutrients. So there may be people, for example, who have damage to their gut and don't absorb nutrients in the way that it used to. So your undiagnosed celiac patients, or somebody, for example, who's had part of their stomach taken away and therefore can't process vitamin B12. So you've got lots of different reasons why people might be undernourished. And then we've got overnutrition, which doesn't necessarily mean good nutrition, but it means there's an excess of energy over a period of time to lead to people living with overweight or obesity. And we've had various documents over the years to look at hunger and food poverty in the UK, and trying to understand a little bit about why people might be suffering from hunger and food poverty in the UK. So thinking about why people might be food insecure, or why they may be vulnerable to food insecurity. And this is where, as I said, their access to food is either permanently or temporarily removed. So their food security is dependent on level of risk. And there's lots of things that have been happening that will have changed this over a period of time. But we're going to just have a look at a few factors that commonly influence food security in the UK. So let's look at these individual factors. So this proximity to healthy food sources and access to food. So that takes me back to that rural location idea of people not being able to access healthy food unless they have either access to the internet to get food deliveries or have a car. So those kinds of things that will impact on people. But some people's health mean that even if they could access something, getting round a supermarket, actually going and doing shopping becomes a difficult problem. And that could be somebody with chronic fatigue. It could be somebody, an older person whose mobility has gone, or someone with a long-term condition like multiple sclerosis or motor neuron disease. So there's lots of different things that mean the mobility aspect of it is a problem. That people can't get to food services. Income, the fairly obvious one, it's the one we think of, isn't it? What can people afford? What can they afford to store? So it's all very well having bigger containers, bigger packets of things are more economical, which they aren't always, and always needs to be checked. But if you can't store them, and you can't store them in a way that they're going to keep and stay healthy and safe, then actually that's a problem. So some people, it's not just they can't afford things, but they don't have a nice big freezer to pick things when they're on offer and freeze them. So they don't have a lot of cupboard space. They don't have that storage space. So there's lots of things that you need to think about there. Education, clearly understanding what good nutrition is, what healthy eating is, but also how to prepare and cook things, because there's many people who do not have that skill. And there's a whole generation that a previous government, who I will not mention by name, decided that we didn't need to learn nutrition and cooking or needlework or metalwork or woodwork, all the practical skills that actually help people to live their day-to-day life. They took them out of the curriculum. They weren't part of the national curriculum. So that means there's a generation there who went through school not learning any of those basic life skills. And that means that that generation, unless they were taught at home, are much less likely to have the ability to prepare food in a nutritional way, but also to know what to do things. There may be some cheap protein sources like lentils, for example. You show those to some people and they go, what do I do with them? They don't have any understanding of what different foods, how different foods can enhance their nutrition and how to cook them. And we also have, of course, the problems on people now having to think about how do I cook using the least amount of energy because of the energy crisis that we're in. And then you have all of the inequalities, which goes back to your wider determinants of health. And it brings in this, physical ability, emotional ability. So you've got people, for example, with poor mental health, making decisions, making good choices is difficult. And you've got people with health problems who therefore end up in a worse financial state. So the whole thing kind of works together to make it more difficult for people to think about what they're actually going to do. Realise those were on individual things. So thinking more about communities and more national risk factors, we've got lots of things going on in our food production system, haven't we? About land use, about water supply, about the state of our oceans and the safety of those. Lots of issues come up about that, and about food safety as well. So there's all of those things that we need to be thinking about. How much land have we got for agriculture? If we continue to have such a high meat consumption, that uses a huge amount of land, therefore we can grow less food. So there's all sorts of different issues that we need to think about. We have climate change, of course, and the extremes that are going on there. So we lose a lot more foodstuffs because of extreme heat or flooding that we didn't used to have. But we now find we can grow things in the UK that we couldn't grow before because of the warming, but also things we used to grow that now don't. So there's lots of those kinds of things going on. Of course, there's a cost of living crisis and there's more poverty. And we've got all of the things going on like Brexit and all of those kinds of things to consider that have influenced the cost of food. Of course, we know that we have the other things going on in a more broad context, political stability. We've been through a bit of a phase, I think, about political stability in the UK, but we are relatively stable and we're not directly in conflict. So we're not directly affected, for example, by the war in Ukraine, but we are indirectly affected because of the wheat cost and the difficulty that that situation is doing to food supply. And then we've got all the trade things which relate to things like Brexit that have made things more difficult. So we've got all of those international impacts making a difference to our local situation. So we have thinking about the food insecurity and security, and it's a bit of a continuum. So just starting from the left and going through here, and this is something that's used for a more international perspective as well. But we have this whole thing about uncertainty regarding ability to obtain food. So that is affecting a huge number of people in the UK. How much can we afford? Is it getting towards the end of the month? Have we got any money left? This whole idea that, are we actually going to be able to buy anything? So there's a lot of people living under that pressure of wondering whether the money is going to last till the end of the month. And so what tends to happen there is that people begin to compromise on food quality. They buy cheaper products, and some cheaper products, that's absolutely fine. But they may just stop having the best brands. That doesn't compromise nutritional quality. But people may have less variety. They may start going for poorer quality food because it's cheap and they know that people will eat it, and there won't be any waste. So we're looking here in this spectrum of people for whom money is tight, resources are limited, and you can't change your bills very easily, but you can change the amount of money that you buy on food. And of course, that then goes on to the point where people start eating less and skipping meals. And that is a frequent thing for single parents. And the final bit is people not having any food for a day or more, which means severe insecurity.